As I enter my patient's room, I will provide her with security and privacy. I'll close the curtain. I'll respect her modesty and provide her with a sheet to cover with. Hi Brandy, I'm Becky. I'll be doing your physical assessment today. How are you?
Good, how are you?
I'm good. As I talk with you, I'll do a general survey of your appearance versus your age, your grooming, and your nutritional status. I will note your movements, your posture, position. I'll obtain a set of vital signs and talk to you about your pain. Then I'll do a mental status exam. I will pay attention to your behavior, your affect, composure, if you're making eye contact with me, your facial expressions. So now we'll start the exam, the physical part. Can you tell me your name?
Brandy Parker.
And your today's date?
11/20/15.
And where are you today?
JMU.
And why are you here?
For a physical assessment.
Good. All right. I'll first inspect your head for shape, size, symmetry, and I'll inspect your scalp and hair for growth, hair pattern, hair distribution. I'll inspect the scalp for any lesions. I'll palpate for any tenderness. I'll note any infestation or scaliness. I'll look at your eyes. I'm inspecting your eyebrows, your eyelids, your eyelashes, your conjunctiva, your pupils, your sclera, your cornea. I'm noting the size and shape and placement of your eyes. I'll palpate the lacrimal sac and glands. Sorry. I am moving on to your nose and noting the skeletal integrity of it, the alignment, looking for any redness, palpating, any tenderness, noting any drainage or redness in the nares, palpating the frontal and maxillary sinuses for any tenderness. If you could put your finger over your nair and breathe in with the other, and the other side. Good. All right. I am inspecting your lips for dryness, moisture, color. I'm inspecting the mucosa, the dentition, counting your teeth and noting their condition, palpating the lips and the buccal mucosa for any tenderness or lumps. And if you could stick your tongue out for me and say ah. I'm noting the uvula, soft palate, hard palate. Noting the size and shape of the tonsils. And stick your tongue out for me. I'm noting the tongue, moisture, texture, if there's any tenderness or lumps. And you make a face at me. Just smile.
I didn't know it.
That's okay. Lift your eyebrows. Good. All right, moving on to your ears. I'm inspecting size, shape, symmetry, placement, palpating the auricle, the lobes, the tragus, for any tenderness or nodules. Inspecting for any drainage. Good. I'm palpating the preauricular lymph nodes, post-auricular, occipital, tonsillar, submandibular, submental, the cervical chain, supraclavicular and the infraclavicular lymph nodes, and put your arms up for me, axillary nodes, sorry, I'm sweating, your inguinal. All right, now I'll inspect the neck for size, symmetry. Turn your head this way for me. Inspect you for any swelling in this way. I'll palpate the trachea and the thyroid. You can sit for me. I'll feel your thyroid. There's good movement. Good. All right. I will go around to your back. As I'm doing my exam, I'm inspecting your skin for texture, color, noticing any lesions on your body. I am palpating your back for any tenderness. Auscultating your lung fields. Deep breath in. Lateral lobes. Good, thank you. I'm inspecting the thoracic expansion. Can you take a deep breath in? Good. Percussing. Checking for any CVA tenderness. Good. While I'm here, I'll check your neck. Any tenderness or nodules. I'll look at your spinal processes. Palpate for any tenderness and alignment. Okay, now we're in the anterior chest. I am looking at the contour of your chest, symmetry, shape, looking for any deformities. I'll auscultate. Percuss. Now we'll move to the precordium. I'm assessing for knee heaves or lifts. I'm auscultating the S1 and S2 of the aortic valve. Pulmonic, tricuspid, and mitral. And I'll use my bell to Auscultate the S3 and S4 of the mitral. Tricuspid, pulmonic, and the aortic. I'll feel for any thrills, and I'll palpate the apical pulse. I'll feel for your carotid pulse, brachial pulses, radial, pedal, post-tibial. Good. Thanks. Do it again. All right, we'll assess the abdomen. I'm looking at the contour, shape. I'm inspecting the skin, to see if there's any distension. I'm inspecting the umbilicus. Auscultate for vowel sounds. I'll percuss. Palpate for any pulsations, inspect for any, and I'll also palpate lightly. And again deeply. While we're here, I'll feel the femoral pulse. Sit up. Sorry. Only one of the musculoskeletal exam. I'm looking at your muscles throughout my exam. I'm looking at the shape and contour, symmetry, looking at vascularity, your skin. Sorry, I get cold.
It's okay.
I'm checking your joints, inspecting them for any redness, tenderness, any swelling, any nodules, lumps, elbows, wrists, fingers, ankles, toes. All right, and then also we'll do reflexes. Just rest your arm. PTRs and patellar. Good. Lift your hands and nails. Capillary refill. Good. All right. You can stand for me. Okay. Stand still and close your eyes. Go ahead. Just stand there for 20 seconds. I'm just going to watch you. Put your arms out in front of you. For any pronator drift. And close your eyes. Good. If you could stand like this and put your heel to your shin and down, slide it down. And the same on this side. Good. Now I'm going to check your range of motion, your joints. If you could put your head forward. Back, side to side. Bring your arms up, behind your head. Bend your elbows, wrists. Lift your knees for me, one. Good. You could walk that way, heel to toe. And then walk back normally. And have a seat. I'm going to check your trapezius and sternocleidomastoid. If you could shrug your shoulders up against me. Good. Turn your head to this, I'll hold my hand here, turn your head to the side and push against it. Good. And this way. Good. I will, as I do this, I'm checking cranial nerve number 5, and you can state, just say now when you feel it, okay?
No. 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 No.
Good. This says dull versus sharp pain. I'm just going to show you what this is dull. This is sharp.
Okay.
You tell me what you're feeling as you close
Okay.
your eyes, okay?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Put your hands out for me. And assess your grip. Good. Pull me towards you and push me away. Great. I think that concludes our exam. Thank you.